Well, good afternoon. I can see that slowly colleagues are joining. So we are gonna slowly start this webinar. It's just 2 minutes past 2 p.m. Um, Brussels time. And we are gonna slowly get colleagues to join while we start the webinar this afternoon. And it is great, actually. We are very pleased that we are organizing this webinar in cooperation with Binti, a partner of ESN, for this year's European Social Services Conference that just took place less than a couple weeks ago in Sweden. So I would like to remind you that we've got captioning as well in place, so you will be able to follow this through the captions as well. And also, I'd like to tell you that we are organizing, as I said, this webinar in cooperation with Binti. And this is a part of a series of webinars that we are organizing within the European Social Network with some of our partners to look at some strategic aspects of public social services and social welfare. I'm Alfonso, I'm the Chief Executive Officer of the European Social Network, and it's great to welcome you all to this session this afternoon. So as I explained to you, the focus of it is to look at how we can design technology which is human-centered to be able to improve decision-making in social services and also to support the workforce. So of course, this topic very much goes hand in hand with a topic of technology to promote autonomy and inclusion, which was the focus of our recent European Social Services Conference in Malmö, Sweden, where we had more than 670 delegates from 40 countries, but also is very much in line with our wider agenda on the area of social services, transformation, and resilience, as well as our work on the workforce. So what are we going to be doing this afternoon? So this afternoon, we are going to be looking at the solutions that Binti has developed in the US. And I'm very pleased, actually, because we are very much open to the idea of cooperation across the pond. So not just working in Europe, where we've got plenty of material and plenty of information with more than 175 member organizations in 34 countries. We, of course, got plenty of material, but we also are aware that cooperation across continents is key. And we are very happy that Binti has joined us as partner this year. And Rebecca is joining us, and she's going to tell us about the solution in supporting child welfare agencies, but also Duke also works with them and was former commissioner in the Virginia Department of Social Services. So he comes with that hands-on experience and very much in line with the experience that our members have. And after this, we are gonna take you through some of the work that we've done in the area of children's services over the years. I'm gonna take you through some examples from an article that was published in a book that I wrote some years ago, where we were talking about ICT-enabled innovations in children's social services. They're not innovations anymore. They're actually very well established ways in which integrated digital case management is actually helping social services professionals supporting children and families. And we've selected 3 of the case studies that we covered in this article. Then we're going to have a panel discussion, and in addition to Rebecca and you, will be joined by Gerard Brophy, who is TUSLA Chief Social Worker, and TUSLA is the Child and Family Agency in Ireland, and also by Dario Peter, who is a team lead program in IT systems at SOS Children's Villages. So with this, I would like now to give the floor to Rebecca, who is going to take us through some of the work that they've been doing at Binti. Rebecca, the floor is yours.
Great, thank you, Alfonso, for that wonderful introduction. Hi, everyone. Really excited to be here and to share more about Binti and what we do. So I'm going to go ahead and share my screen and talk through a little bit about some of our solutions in supporting children's welfare services in the United States, as well as how we've taken a human-centered design approach in the work that we've done. So I have pulled these up if everyone can see. And as Alfonso mentioned, my name is Rebecca. I'm Chief of Staff at Binti and was in Malmo a few weeks ago and had the pleasure of meeting some of you in person, and hopefully we can also continue the conversations from here. So in terms of just a brief background on Binti. So Binti is based in the United States, and we are a modern mobile-friendly software company built really specifically for child welfare. So the way that we actually started is that our CEO and founder, Felicia, she really started the company due to a personal connection. So her sister adopted 2 children, many years ago now, and the process of actually becoming a licensed foster adoptive parent was a really difficult, stressful, complicated process. The whole thing was done on paper. It was very confusing what steps needed to happen, what requirements there were. It was really hard to communicate effectively with the agency that was licensing her. And Felicia saw that technology could really make this process more easy for families. And so here's a photo of Felicia and her niece and nephew. And that was really how Binti got its start. She also then saw on the agency side, her sister finally was able to adopt, become licensed to adopt these 2 children. And when it came time, the agency, said, we have such a shortage of families, and her sister was the only one that had gone through the process in the last few years. And so it didn't really make sense. Like, on the one hand, we make it really difficult for families to become licensed and engage in this process. But then on the other hand, the agency has a shortage of families and actually needs more families. And so there was a bit of a disconnect there. She ended up shadowing a lot of the agencies who control the process and saw that they were using essentially, they were gathering stacks of paper from families. They were using sticky notes to keep track of things. They were using actually also a 70-column Excel spreadsheet to track all the trainings, the background checks, the requirements, all the pieces that might go into licensing a family. And so it was not only a difficult process for the families, but it was also a very difficult process for the agencies themselves. And so that's really how Binti got its start. We also, in the US and through our conversations with folks in Europe, we've seen some of this as well, is that there is software in the space. So there are IT systems that gather certain pieces of but at least in the US, they need a tool to support your work as you're in the field, as you're actually working on the project. It's not really an easy tool to use. It's basically that you're using paper, and then at the end of the day, you have kind of an extra step to go back and enter the necessary data that you need to, which is obviously not necessarily a human-centered design approach. And so therefore, social workers, as I said, they're kind of doing all their work on paper and then having to come back and enter data, which takes more time. And from a lot of our work with staff, they've basically shared that they spend about half their time, doing administrative work, and only half their time, directly supporting children and families, which is, of course, why they've gone into this field. This adds to social worker frustration and churn, and of course, less time to focus on children and families, which is the goal. Oh, my connection is poor. Okay, sorry about that. Hopefully it gets better. I will maybe turn off my video if that helps with the quality. But let me know if folks are having trouble hearing me still. And so that's really how Binti got its start, was building a tool specifically to support families to get through the licensing process, and also agencies to support that. And so, as I said before, we're a modern mobile-friendly software company built really specifically for child welfare. And we really want to, work and empower organizations to embrace this human-centered design approach, in the implementation of tools. We want software to be something that helps the work rather than is a hindrance that they have to, as kind of an afterthought that a necessary evil, having to enter at the end of the day or after the work has been completed. And so, as I mentioned, this process was very manual. And so the first module that Binti built is a licensing module. So this is really our flagship module. Basically how it works is it's a dual facing portal. So families apply online themselves. It's mobile friendly. They can do it on their phone or on a tablet. And essentially they fill in all the information needed to become licensed. So that includes entering information on forms that might be required, uploading required documentation such as a driver's license or proof of income or auto insurance. And then in real time, as they're entering this information, the agency has a dashboard to keep track of this process. So this is really allowing families to enter a lot of the data directly rather than workers, collecting this on paper or in other ways and then having to enter it themselves. We also auto-populate information that's already been entered elsewhere in the system. So for example, if a family, enters their name, that's going to pull through into all the other places that the name is required. And so that really reduces duplication of entry and allows families to have a much easier and smoother process going through this. And so on the agency side, there's a really clear dashboard. They can see how many families are in their caseload, how long families have been in the process, which also allows them to flag families that might be lagging behind and be able to speed them up, as well as key reports to talk about the progress of what they're working on. And as I mentioned, this is mobile friendly. So this is just kind of a look of what it would look like on a phone. In addition to being able to complete forms, electronic signature is also a key function of this. So families can sign documents, caseworkers can also sign documents without having to leave Binti at all. So all of it is done seamlessly through there. And we also provide chat support as well for both families and for workers. So this makes it easy to use in the field instead of having to, mark down somewhere and then copy separately. It's all done in real time as the work is happening. So that's a little bit about our licensing module. That module is very widespread, and I'll talk a little bit about our reach and our impact in a moment. So another key kind of function that Binti supports is the family finding function. So these are two examples of two of our key modules. We do also have other modules that support placement of children and tracking requirements for children. But given the time today, I'm going to focus specifically on these. And so family finding is similarly, something that was very paper driven in the US before the emergence of Binti's module here. So essentially family finding is the practice of identifying family or fictive kin for youth. Our goal more broadly is really for children to have a fair chance at life and through that, in order to do that, to have permanency. So, end up in a safe and loving home, either whether that's, reunification with their family of origin, but if that's not possible, being able to be placed in a family setting, ideally with relatives or kin that they already are familiar with, and then if not, with community homes. So of course, the licensing module helps both relatives, fictive kin, and non-relatives be licensed to be able to take those children. But in addition to that, we really want to support workers to do more to actually identify relatives in the first place, and then really, be able to get them through the licensing process. So before Binti, essentially the family finding process in many agencies was, doing a search. So a search might happen through a database, but then once potential fictive kin or relatives are identified, a lot of that is written down on paper of, okay, who is the aunt or who is the, cousin's, second cousin, whatever it is. And once they've written that down in on paper or in a Word document, it's basically, having that there and not being able to really kind of share it with other staff. In addition to that, family trees were often drawn on paper. So being able to visualize what the youth supportive network looks like was often done on paper. And so this is very difficult for both for record keeping and also for staff within an agency to effectively collaborate. So there might be a search tool, and then there might be kind of a place to track outreach, but it's not really all done in one centralized place. And so what Binti has developed on the family finding side is essentially within the system itself, as you can see on the screen, staff can actually search for via a database that's integrated, can search for potential relatives and fictive kin of the youth. So here you can see, someone has been searched. You can see the potential results that have popped up with the name and contact information and the source of that data. So a lot of these databases pull in sources from a variety of places, such as Medicaid records, which is obviously relevant in the US, as well as things like social media as well. And of course, in addition to searching in the database, workers can, of course, manually add fictive kin and relatives that they come to know. We've often heard that through, case notes and things, different folks pop up into the narrative. And so I'm going through those as well, and calling folks or actually asking the children themselves about who they're connected to is another great way to identify relatives and fictive kin. And so the element that Binti also supports within this is actually outreach to those families and contacts. So you can basically draft a message in here. You can send it both via email and SMS, which is very helpful, and then send that. And so that actually saves a lot of time in terms of manually reaching out to all of them or sending physical letters as well. And then you can essentially keep track of all those relationships. So you can see kind of a comprehensive dashboard of, the relationship type, what the contact status was, the level of support that they're able to provide, and all of that's in one centralized location. Of course, ideally we identify folks that can take the child as a placement, but even if they can't, we want to really build that supportive network. So even if they're not able to be a placement at the moment, maybe they're still open to, picking up the child from school on Fridays or taking the child for weekends, and at least kind of building that up and having that record as well. And then, as I mentioned, a lot of family trees were drawn on paper. Binti Binti has this virtually in the system so that family trees can be drawn out and really kind of identify where there might be gaps in the process as well. And then lastly, and then I'll pass it over to Duke to talk a little bit about, the key elements of human-centered design that we wanted to highlight here within our work. But here's just a kind of overview of the reports and analytics that family finding supports. So not only looking at placement opportunities, but seeing supportive relationships, having actually just a raw kind of contact log of everyone that has been spoken to related to a child, as well as key metrics. So, identifying how many supportive connections have been found for the child, percentage of connections by parental lineage, being able to look at supportive connections, and then of course, just overall what the kinship placement rate is. So that really, again, hopefully that helps. But that really, helps workers draw key insights as well. So that's a little bit about our family finding module. More broadly, I'll just talk briefly about our impact and then pass it to Duke quickly to wrap up here. But we've launched in 2017 with these modules and quickly expanded to work in about 38% of the United States with at least one of our products. So our real flagship module is licensing, which was the first piece I talked about. That's used most widely. Family finding much newer module. Are excited to launch outside the US as well, is that we've really seen measurable positive results. So on average with licensing, agencies are able to approve about 30% more families in about 18% less time. So that really helps agencies make a meaningful dent in the shortage of foster homes and help more youth to be in family settings, which is obviously ideal, versus congregate care. And so that's something that we're really proud of. And that's one of the reasons we've been able to grow so quickly. We've also seen, an estimated 20 to 40% of social workers' time savings. This is based on, interviews with workers and them kind of sharing that because they're not doing it on paper and then copying it into a database, that also really helps time as well. And so we're the pioneer for software as a service. I'm not going to go too much into that, but that's kind of our model, is that we continue to maintain the system over time and support versus building kind of a custom built system for each agency and passing it over to them. This has a lot of benefits in the fact that this is already built. It's a lot less risky for for agencies to simply subscribe to the module. And it also helps the field grow over time because we're constantly making upgrades and enhancements to the software. So with that, I'm going to pass it over to Duke to just talk quickly about specific examples throughout our modules of Binti's human-centered design approach.
Great, thank you, Rebecca, and good afternoon, everyone. Really appreciate your time. I am the Vice President of Child Welfare Strategy here at Binti. But before Binti, I was Commissioner of the Department of Social Services in Virginia, and child welfare was one of our responsibilities in addition to income support and other services. Couple things about Virginia: we had a little over 8 million people in the state. We had 6,000 children that were in the custody of the state that were in our child welfare system. We had a couple really sort of profound challenges that we had, and one of them was the workforce. So we had a very difficult time hiring and training our workforce to help with our child welfare services. The standard caseload, the optimal standard caseload in the United States for child welfare is about 12 children for each worker. And we had 25 children for each worker in Virginia. And the other challenge that we had is that we had a very high turnover rate. So we had about 22% turnover rate. Work was hard, the caseloads were high, the stress of dealing with these very challenging cases. And part of that stress that we learned from our exit interviews of our workforce was that the work was not just difficult emotionally, but it was difficult because of the tools that we gave our workers. It was a paper-based system. Like Rebecca articulated earlier, they would have to do their work in the field, driving out to people's homes and doing investigations and doing their work. Then they have to drive back to the office and input data into an old legacy system that we use to report to the federal government to meet our requirements. So in Virginia, we put a mobile-friendly front end onto our child welfare platform, and it changed the dynamics of the work that workers did every day. Instead of going into the office and getting their caseload in the morning and then driving back out, they could leave directly from their homes and go out and do their work and enter it, on their phones, on their tablets, the tools that we gave them. And it cut their driving time by 25%. And so Binti provides a mobile-friendly, easy-to-use solution that includes the dashboards that enable workers to see what work they have before them that day, to do their work, and it saves them time and increases their satisfaction. So we started to see our turnover rates go down once we put a mobile-friendly solution. Next slide, please. The second thing that Binti does, and we didn't have Binti in Virginia, and now that I'm here at Binti, I wish that I had bought it when I was commissioner in Virginia. So one of the things that happens in the United States is we request information from families for applying to be foster care homes. We ask them for the same information over and over again. What's your name? Where do you live? How many children are in your home? So in Binti, we take all of the data from all of the forms and we look across all of the different forms. And we create a new user interface for families where we ask questions only once. And then those data populate across the whole life cycle of that case. So we will never ask what your name is again, or your social security number, or your license information to verify identity. So we pre-populate fields over and over again across all the forms for the life of the case. This saves time, reduces frustration, and really creates efficiencies for the families and for workers. Next slide, please. Finally, we really struggle with families completing the process of licensing because there are so many requirements. There's requirements driven by the federal government. There's requirements driven by state law and policy. And so the number of forms that have to be completed, the number of documents that have to be uploaded, the completion of background record checks, all of those requirements are often not able to be met in one sitting, right? I have to gather information and come back to the process and upload a document. And so Binti automatically reminds families of what documents have to be completed, what fields have to be filled out to complete the application, what trainings have to be done before they can have a child come into their home. And this automatic reminder really saves worker time. Our goal in Binti is to free the worker from processes and tasks that can be done automatically that we can build into our system for that higher value work that they've been trained to do. And that increases their satisfaction. Workers want to do what they've been trained to do. They want to work with families. They want to engage in that sort of higher level interaction. And by automatically reminding families to complete requirements, we're able to save time, increase the efficiency of the time that families take, and increase worker satisfaction. I think that's it, Rebecca. Thank you. Oh, finally, sorry about that. Finally, providing an e-signature supports families, social workers, and the bureaucracy to save time and avoids, another step in the process by driving, into the office and signing a form. We build this into our system automatically. Also saves the agency important resources by having that be integrated into the system. And now I'm going to turn it back over to Alfonso. Thank you.
Oh, thank you very much, Rebecca and Duke, for this presentation about the use of Binti and how Binti programs and software can help children and families. I mean, you've presented a number of examples there, and we've got also some questions in the chat as well, which I saw Rebecca already answered. So that's fantastic, and it's a great way to start this conversation with some examples of how technology and ICT enabled case management systems can help social workers reduce the time that they invest, in this case, in allocating families to children who are in the child protection system, and also to ensure that social workers can invest more time in the work that they are supposed to do, which is to do social work with those children and those families. So thank you very much for this. I remind the audience that you can continue to send your questions through the chat or through the Q&A session on your screen. And now I was also requested, before we go into the discussion, to take you through some examples of the work that we've done within the European Social Network in relation to children's services and more broadly children's well-being, which is an area we've been working on over the past over the past 2 decades. So if we can move on to the next slide, just very briefly, what you know who is ESN. So I'm not gonna take you through this. We are the largest community of public authorities working in social services within Europe. But I would like to emphasize the key role that public social services have in terms of ensuring equal opportunities for all families and children. They provide support for disadvantaged children, families, young people in all forms, whether it's support for parents, child protection, alternative care, and also supporting vulnerable young people in education, employment, training, housing, as well as in their transition from the care system into adulthood. So if we move on to the next slides, in terms of the European context, over the past 20 years, there have been a number of policy papers from the EU which are relevant for the work that we do. In 2013, the Commission passed a recommendation on investing in children with a 3-pillar approach, which was related to access to benefit services and child participation. That was in relation to this recommendation, we address the importance of promoting or addressing poverty from a multidimensional perspective, focusing not only on child family income, but also on the concept of poverty of opportunities. But progress in countries was limited. There was just one report, and since then there have been other focuses. Last year, the European Commission launched 2 initiatives. One was a strategy on the rights of the child, which was the first policy framework actually in this particular area, and the European Child Guarantee, which was an instrument promoted by the European Commission's Director General for Employment. And this is interesting because this is related to EU funding, to the use of the European Social Fund to promote specific programs in early childhood education and childcare, education, nutrition, healthcare, or housing to help children access those. So here the European Commission might be able to evaluate actually which European Social Fund projects in countries had these aims. We will see towards the end of the financing period, towards 2027 and 2030. Of course, public social services have a key role in delivering most of these targeted measures which are covered by the guarantee. For instance, funding to support nutrition programs for disadvantaged families, or access to early childcare for children in child protection, or after-school activities for disadvantaged children. But all in all, we felt that the child guarantee missed a number of things. One was the reference to social services, which are the authorities, which are the corporate parents and the authorities dealing with the most vulnerable children. And they miss also children who are in the child protection system, unaccompanied children and others who are usually in the child protection system, and also addressing a wider systemic lack of cooperation between children's services. We see that the focus here was more on specific programs rather than on children, on groups of children, and also on wider strategic system measures. We also do an analysis of the wider implementation of the European Pillar of Social Rights, which is the framework that sort of rules social issues within the EU. And one of those principles, Principle 11, aims at addressing the social inclusion of children in disadvantaged situations. And in all of these assessments on a yearly basis, we've been highlighting the need to have a larger focus on child protection, because those services are costly for children in very vulnerable situations. They need to recognize their key role of public social services in prevention and early intervention, and also as corporate parents when placements take place, and better coordination among different agencies who are involved in supporting and protecting children, not only social services, but also education and health. So if we move on to the next slide. So these are some of our key recommendations that we put forward to the European Commission. We talked about about the importance of improving cooperation between services and having an integrated approach to service delivery. We talked about the importance of preventing and intervening early and doing so in an integrated manner, which is essential to support children in the best interest, which is Article 3 of the UNCRC. They need to develop national frameworks which involve key agencies who have the responsibility for children in the most disadvantaged situations, as this is the case for social services. And very importantly, to look at targets, both quantitative, so knowing the number of children who are in care, but also qualitative, the quality of the services provided. What were the actual outcomes for children as they are in the child protection system, but also as they leave the child protection system. So if we move on to the next slide, here I would like to take you through the focus which is for this particular session today, which is on technology. And what we've seen over the years is that social services have been increasingly focusing on giving people using those services more choice, designing services around the needs, and a growing focus on coordination, on integration of the provision of social services through a number of enablers, and one of them has been certainly technology. There is a growing expectation that staff in social services would have access to information management systems, to data sharing platforms, to IT devices to help them carry out their tasks more effectively. And there are plenty of examples of those: integrated children's assessment tools, digitalizing data, electronic child protection registers. They are all illustrative of tools which have been developed and show that tech can make a key contribution to the delivery of children's services. But there are many more benefits as well, actually, beyond safeguarding the most vulnerable children, because with better management information systems, there are plenty of other opportunities that we can use to tailor services to the needs of children as they evolve. And of course, with more holistic data about children, there are also a number of opportunities that open up in terms of being able to improve strategic planning across social services, both in local and regional authorities. So we have selected 3 examples from an article that I wrote for a book some years ago. It was entitled at the time, ICT-enabled innovation, but these innovations have now pretty much become structural, and there are now new innovations that are opening up. However, I thought within this particular topic that we are discussing today and the solution presented by Binti, I felt that they were well along the lines. So we've selected the Child Index from the Netherlands, DUBU from Denmark, and the Alborada system from the region of Andalusia in Spain. So I'm going to take you through each of them, and then we'll come up with a short conclusion. So let's take the first one. As usual with other developments in child protection, the Dutch Child Index was introduced after an investigation into high-profile deaths of children in the Netherlands. And basically, the revelation was that there were many professionals who had been working with the children without the knowledge of each other. As a result, in 2010, the Ministry at the time for Youth and Families enacted a new regulation, which was a reference index for young people at risk, which was included in the CARE Act. And this set out the introduction for the Child Index, which basically allows professionals who are working with children to be made aware when other professionals are also involved. So basically, the way it works is by professionals flagging a child at risk on the index. The signal is sent in the case of a match where another professional has then registered the same child. At this point, the professionals involved are provided with each other's contact details, and one is designated as the coordinator, who will then organize the coordination of support for the child or the young person. The index is actually used for children and young people until the age of 23, and it can be accessed not only by social workers and family guardians, but also schools, child daycare facilities, the police, and health organizations. The way it is organized, because the system in the Netherlands is very decentralized, is that each municipality is responsible for organizing their own reference index, which can then be tailored to the specific context and is connected with the wider national index. One of the key issues about these programs is the question of privacy. And indeed, to protect privacy, the Dutch index limits the information about the child to their name, their social security number, address, date of birth, and very importantly, the details of the professionals who are involved in their care. When a flag is raised, then the child, and usually the parents, must be informed, and consent is needed in the case of a match before the match professionals can be able to share the information with each other. In terms of transferability, I thought it was also important to mention that this system has actually received attention from abroad, and there was a pilot scheme in 2013 in Finland, which was successful, and since then, a signaling index was also implemented in Finland based on the Dutch model. So what does this index demonstrate? Well, first, the possibility for an innovative, at the time, ICT solution to allow for a more coordinated approach by automating the connection of professionals when their responsibilities overlap. Then the professionals using the program provides a good example of how they can actually take an active role in the design of the ICT system as well. And also something that was seen at the time, and we will be discussing in a second, is how difficult sometimes is changing the professionals' perceptions. Because in many respects, despite efforts to persuade professionals about the importance to recognize the benefits of the index, many still remained skeptical. Some felt it was more a distraction from their more tangible work, which is usually to work with and to talk to and help the children. The second example is the DUBU, which is digitalizing data about vulnerable children and youth, which was introduced in 2011 in Denmark. Basically, this involved the introduction of an electronic assessment form based on the framework of the UK's integrated children's system. So as you can see, there is plenty of international connection with this system. There's plenty of information that is shared across countries. So why was this needed? Well, they realized, as you probably know, Denmark is a very decentralized country, and the ministry and the local government association realized that there were a number of issues, a number of challenges. Case management for children at risk was becoming increasingly expensive. There was a lack of harmonization between the municipalities in how they were handling or managing cases. There were many examples where municipalities were being blamed for the poor way in which they were managing different cases. And there was a need to ensure that the perspective of the child, the parents, and the caseworker were allowed within the assessment. So the idea, and also to be able to support the implementation of the systems in the municipalities, was to have some form of a super user. And they were basically trained in using the system by the developers in the first place, which in this case was the company IBM. And then from there, they could continue training others so that there would be more and more users of the system within the municipality. So some of the outcomes, the improvement of professionalism in the sector, because of course, professionals were able to follow a common procedure. The employees had better access to the overview of their cases, the opportunity for managers to have the necessary information, the information exchange between the municipalities themselves, because they were using a similar system, and also to have better assessment of the data to be able to make decisions within the municipality. And the third case study that we selected is Alborada, which is an early warning system for young children with developmental problems from the southern region of Andalusia in Spain. And this was introduced in 2011. And what is interesting is that it was co-produced by the regional Ministry of Health, together with two local companies, professionals that were working in early intervention centers, as well as health services and the civil servants from the ministry. Basically, the issue was similar to the other two cases. There was just not one system across all early intervention centers within the region that presented information about the child in a consistent manner. And there was a lack of communication tools for the professionals involved in caring for those children. So what did the system do? Well, first of all, it was clear that there was a need to create an information system to help identify the number and actual coverage of all care services for this group of children, as well as the risk factors and the types of disabilities. Also, to keep track of the early intervention resources, both public and private, which received funding from the regional government, as well as the services that were available and the intensity of the interventions. And finally, to act as a mechanism to ensure the continuity of care between health services, early intervention centers, and other community-based services. So the data included was general information about the family, data about the child's problem and health condition, information about the socioeconomic situation as well. So, for example, the children's school and others. Each file is assigned to a case manager, and all professionals who can access the system may be able to see who is the case manager and the centers where they work. So professionals use the system through a website, which basically all the professionals use. They're working in public, for-profit and non-profit early intervention centers, disability and social services assessment teams, education professionals, and primary care pediatricians who work in public health services. They receive periodical training as the system is further developed, and professionals can create their own system profile, which is then accessible by all other professionals who use the system, so that they can receive notifications about any changes and keep track of the work that they've been doing with those children. It's a free software, so that means that it can be requested free of charge to be used by any other public administration, so that they can adapt it to their own context. So moving on in terms of our current and our future activities in children and youth services, of course, the area of technology, if we can move on to the next slide. Of course, the area of technology is of particular relevance to us because, as I said earlier on, it fits within our wider agenda on transformation of social services. But of course, we are looking at a wider set of responsibilities of children's services in the area of social welfare. And we are now working on a specific project, which is addressing the role of social services in addressing violence against children, with a focus on good practice and professional training needs. And next year, our seminar will focus on community and family support for children and young people, looking at generating knowledge on children's services transformation to be more community and family based, and also investments in the children's social services workforce as part of our regular workforce activities. So with this, I hope that it will open series of questions that we can then address throughout the conversation that we are going to have, also not just with Rebecca and with Duke, but also with Claire and with Dario. And before I forget, because as it was on the screen, I remind you also that our European Social Services Awards are open until, applications are open until the end of this week. And this is a great opportunity for those of you working in areas related to child-centered care and support to submit your applications. So let's now move on to the conversation. If there are any questions, please send them through the chat for the Q&A. But let's now welcome also our colleagues, Ger and Peter, who are with us, and join Duke and Rebecca to have a conversation, having heard the various programs across the US and Europe based on technology to support child protection and wider child social welfare and children's services. I was wondering if I can start by asking you a question. What are the challenges that you see in terms of technology to support social workers work and help them with decision making? I mean, what are the issues that you see in terms of how the workforce is taking up those technologies? Maybe you can start with Ger.
Thanks, Alfonso. And again, thanks to Binti for that really good presentation. And again, Alfonso, to yourself for those really interesting examples as well. I think in Ireland, in the Child and Family Agency that I'm working in, we're engaged in a technological revolution of our own in some ways, moving from paper to increased ICT capacity. We've had ICT in some parts of the organization. We've had a number of different systems, and we've integrated into one new system now that we've developed ourselves that we're calling TUSLA case management. But I think some of the challenges we've faced is getting that balance between having a system that facilitates workers to do their work and having a system that takes a lot of time to do recording on. So whatever system you have, it has to achieve a balance in that so that workers actually get the time to build relationships, to do that face-to-face work, and don't spend too much of their time on the recording piece. So facilitating work is really where we want to get to. And there is a balance to be got in that. I think part of how you can do that, and Binti had a good example of it there, is facilitating families to be active on a system themselves in terms of sending in their details or driver's license, whatever income details you have. So if a system can facilitate that to happen, that's, I think, really labor saving on the workers then going back, and it automates the replies going. I think that's really useful. I think we've developed something similar to that in creating a referrals portal where the public can access a portal, and any referral they want to send in to TUSLA can be done on that portal. So a concern about a child, as part of that, they get an automatic acknowledgement that referral has gone in, to get an acknowledgement number, so then that can be traced and followed through the system. And we're now beginning to network that portal system with our own case management system so that can be networked in. So I think for me, that's probably the main challenge in terms of getting that balance between, a system of record, but facilitating workers to do that work, to do that face-to-face work. And I know you may have more questions later, Alfonso. We can come back to that and give Dario an opportunity to come in.
That's great, Gerd. Certainly, that gives already an idea of where your views are. I was wondering whether, Dario, you can take us through your views in terms of the challenges for social workers.
Thank you so much. Also, thank you so much for the interesting presentation. I think there's a lot to learn from how Binti solved some of the challenges, and I would also agree with what Ger said. To add something on my side, I would maybe shortly introduce my role in the organization. So I'm representing SOS Children's Villages International. I'm responsible for a team who builds a case management system rolled out in 100 countries. So it's an NGO, and we do case management for with foster families, but also kinship care and other forms of alternative care and family strengthening. And we build an in-house system, and for the last 10 years rolled this out. And what I see as a challenge is, there's many challenges when it comes to technology, but I often think that technology is not necessarily the problem, but that the business process that you want to follow is not well established. So you're putting a case management system on top of a case management process, but who says that the case management process is running as smoothly as it should be? And then sometimes the systems are being blamed. And of course, the systems are never perfect, but sometimes I think the systems just detect the issues in the process, that certain assessments are not being done, or that there's too much information being requested, etc. So that what was a learning for us. Have a look at the business processes before implementing the technology. And one maybe in addition is that we often faced issues between how much flexibility do you need on the field versus how much do you want to standardize to inform the decision-making of the whole organization. So if we really look at the social worker's perspective, they might not even want to have scales from a 1 to 4 that you select something if you assess the situation of a family. They maybe just want to have text data. But then how do you aggregate this to inform the decision-making on the whole organization or government or federation, whatever scheme you work in? And to balance this is, I think, quite challenging. Having a useful tool for the social worker, but also something that informs decision-making on a larger scale.
Thank you very much, but I was wondering, Dario, I was wondering if I could ask Rebecca and Duke, what was your views based on what you've listened from Geir and Dario?
Yeah, I can jump in here. I mean, I think Dario really hit on something that we see over and over again in the United States, which is people jump to building a technology solution, but they don't look at their business process and their service process ahead of time. So doing that business process reengineering, I think, is really important. On the other side of that coin, I think, is change management. So even if a state or a private agency does a nice job with their business process and putting technology in place, taking the time to do that training and that culture change and that change management around the solution, I think is something that gets cut out of a lot of the budgets. You know, I only have so much money. I'm going to spend it on building a new technology solution, but not really doing that necessary change management. And so we see that a lot of agencies don't get the full value out of their solutions. One of the things that we do at Binti, because we're a software as a service, it's a different business model. We assign a customer support or customer success manager to all of our projects, and they look at the utilization of the product and they do ongoing training and technical assistance so that the full value gets out of it. A couple other challenges that we see in the United States, you know, one is we have a digital divide where a lot of families don't have internet access. And so we build, you know, these really great solutions, but they're not accessible to a number of families. And so working on the technology infrastructure is important. And then that also applies to families, to workers. So they may be going out into homes without access. And so really looking at disconnected mobile solutions is a really important feature, at least in the United States, because we have that digital divide. And finally, I think there's some real interest in leveraging artificial intelligence and machine learning to help the decision-making process. But because the models that are used to train, the data that's used to train the models is based on largely the historical experience that we have in our child welfare system, there's a lot of concern about building in bias into the models. And so how we correct for that bias is a challenge that's before us. I know at Binti, we've been really reticent to take the decision-making power away from workers, even though the allure of having AI do that is right before us. And we've seen really, positive examples in the private sector. But there's just a lot of concern that we have. So those are some of the challenges that we see in the US. I don't know, Rebecca, if you have anything to add to that.
Yeah, I think you touched on the main points. Just one quick thing to add about change management. I mean, a huge thing that we've seen is that, leadership buy-in is really important. So even if staff are super engaged and wanting a new tool, any technology, even for folks that are very, excited about technology and want to adopt it, it really needs to also come from leadership. So being able to kind of dictate that the process is really helpful, and any system is only as good as the data that's entered. So having leadership buy-in to ensure that the data coming in is active and clean is a huge challenge, but also a huge opportunity for system transformation.
Thank you very much. Before we move on to a couple of other questions, there are some questions that came up on the Q&A section, and I think one of them is direct addressed to yourselves and Binti, because it's talking about the supporting foster licensing, and there is a question there around how we are pushing to better support peers with lived experience whose background checks and being very subjective based on paper. So the question is, how could you see enhancing this process from the view of Binti? So maybe Rebecca or Duke, you could answer this question from Jared.
Yeah, I can chime in, and Duke, if you have other thoughts. It's a great point. I mean, we, as a tool today, we don't necessarily make the decisions about who should be licensed and who shouldn't. That's definitely put in the hands of the worker and the agency. That being said, I think this ties back to, what is the business process and how can technology support that? I think it's a really important point of how to ensure that, background checks of 20 years ago or something is not preventing really great families or families with previous lived experience to become foster parents. What we've seen in the US is different policies have been written such that families can get exemptions for certain background checks, obviously depending on what the type of feedback from the background check is. That obviously makes a big difference. But if a relative or if an uncle is, taking a child, which is obviously the priority for that child to be placed with them, that, the fact that they maybe had, a hit on the background check from 30 years ago or something shouldn't impact that, and that there's, exemptions and other processes to ensure that family can be licensed. So I think that's a process question and something that agencies are trying to grapple with and overcome. And then us as the tool can obviously help surface that more easily. I don't know, Duke, if you have anything to add to that.
Yeah, I mean, the requirements are really driven by federal and state laws, and some states are more stringent than others. I think the role that technology can play is helping to surface the gaps that we have in placing certain children, older youth and youth from minority populations are disproportionately sort of represented in our child welfare system. And we see difficulty in placing those children. And so I think the data that comes out of a well-designed system can provide the type of analytics to inform the decision-making on the policy side. But ultimately, it's a legal constraint, at least in the United States.
Thank you. And there was a question, since we are talking about the challenges, there was a question from Erla about what helps the most in supporting workers to make the shift to technology. So maybe, Gair, we can ask you what in your view, can help.
Yeah, I think that question may be from Ireland as well, but I think in our recent experience, it's something that's been mentioned already there, but investing in that change, so supporting workers to do the change. So in our recent technology changeover from one system to another, we introduced a role of a leader for change, or a change champion, who would link with local change champions in each of our areas and coordinate activities that would support change. So we'd have training in each of the local areas with all the workers. It would be led by those local change champions and some support from additional training staff. We'd have local meetings with those staff in the areas to identify, well, what were their main issues. We had a series of videos that were produced highlighting the benefits of the system, highlighting what was coming down the line, what they could expect to see. And then we followed that up with the training, as I described earlier, when the system was coming in. And then an intense period of 8 weeks of support where we had trainers or individuals from ICT or from the system available in each office to answer questions, hold people's hand as they got used to the new system and bring them through it. Now, at the end of the 8 weeks, people were becoming familiar with it, but then we still had a very intense involvement through our help desk and answering queries, and again, having maybe less frequent area meetings or national meetings with those area change champions to work through those problems. So I think we've seen a graduated approach, intense in the beginning and then less so, but a huge investment in holding people's hands to get used to that change. That's what we found has been very useful in our situation around that.
Thank you very much, Gary. I wonder if, Dario, you feel the same about investing in holding people's hands.
Yeah, absolutely. And I fully agree with everything that has been said. And if we go one step even before, like that's the saying, you should design with and for a user. And I think if you achieve this, then the users like it. And if not, they don't. So if we sit together holding of a user, definitely for implementation, clearly, absolutely. Ideally, even if in the design of it, I guess this was also meant with this comment, that you really, and working in an iterative approach, I think none of these systems has been developed overnight and is now brilliant, but listening to the user's complaints and developing it further, and listen again and developing it further. And then I think they see the value in it because they raise something where the system could help them. You build it for them, and then convincing them is relatively easy if it's built well.
Thank you. Thank you very much. I wondered if Rebecca or Duke, would you like to just come in to complement what has been said by Gera and Dario?
Yeah, I mean, to the point of, including the individuals that you're serving and the workers in the design of your system, that Dario was talking about, that human-centered design principle, I think is so important. We have seen a lot of lessons learned, the hard way. I know I've seen applications, at least in Virginia, we didn't have Binti, but we did a lot of work on the income support side to create like a portal for families, but we failed to put an e-signature in place and a phone-based signature in place. And so a lot of good work was done for 95% of a process, but still then required people to come in and sign a piece of paper. So that e-signature was such an important element that we missed because we really failed to do that sort of observation and shadowing and structured interviews and the kind of human-centered design things that are important. So I really think you can make a lot of assumptions as a technology company or as a business, a service executive sitting in an office, but you really need to be out in the real world, observing what's happening and having those conversations to really create a process that works for everybody.
Thank you very much. There are a couple of other questions here, so I was wondering if maybe we can run through them as well. Says, what is your opinion on solutions that may not address the larger software issues of case management, which we've been looking at, but more digital solutions that help support social workers in their individual workflows? What would you say, Gare, about that?
Yeah, so I think actually the Binti example of people applying for fostering, entering their own data is a really good example. And I think we've seen other examples. We don't have it yet in our system, but if you can export part of the form that a child or a parent might complete and send that to them, and they can complete that and send it back in, I think that again would be labor saving for social workers. And I think the signature, as was just pointed out by Duke there, I think that's really important. We see that in, let's say, child and care review forms that's come up for ourselves, you know, as a user request, putting in that signature stuff. So that stuff I think is really important. It simplifies it. I think other things like having a chronology on the case file. So, you know, you have the ability to summarize the data that's there, put key incidents into a chronology, and that the IT system will automatically create that. It's a really good way to organize the information, these large case files that we have. Or another thing would be having the technology slick, so that if you need to store an email from a different system in your case management system, that you can just drag and drop it. Again, we've introduced that in our system this year. Those type of things that prevent or avoid having to save something, save it in a different format, and then bring it into your system and then put it there. If you can take it, do it in one step rather than four. That's really important in terms of time saving for workers and giving them more time back for the face-to-face work. Those are things I think are really, really key. And working with the workers to identify what they might be.
Thank you. I was wondering if any one of you, Dario, Rebecca, or Duke, have anything else that you'd like to ask to Kira's answer.
Yeah, I'll chime in quickly. I think another piece of this too that Binti has really been advocating for in the technology ecosystem within the US is about modular implementation. So I think that Chupa's question touches on this a little bit, that you know, it doesn't have to be a full kind of big bang implementation at once. In fact, honestly, that typically ends up being more challenging than kind of doing system transformation bit by bit. So if for example, you know, Binti's real model is, you know, you don't need to transform the whole system today. Start with the foster care licensing piece, or start with the family finding piece, as the rest of the system is maybe modernizing later. And so I think that bit by bit can actually ultimately have a better impact on individual workers, especially saying, okay, this is the team that's going to kind of be impacted by this systems transformation, and then the next team will be impacted by kind of the next flow of it. That just helps agencies kind of not bite off more than they can chew at once, and be able to kind of implement, see that it works, and then move on to the next. And of course, having data that can exchange between all of these systems is key, but not having to have a kind of full scale system change at once, and being able to kind of take a step forward one step at a time. So I think that that really kind of complements Binti's model of systems change as well.
Thank you very much. Duke.
Yeah, one couple things to add to the conversation. One is there are typically lots of different stakeholders that are involved in any one case. There's the family of origin, there might be the home of placement, there's the caseworkers, there's probably service providers, either therapists or other service providers. And so having a system that is centered on the child and is accessible and usable, you know, with the required permissions for access to see certain data, I think is really important. And, you know, I think Dario and Gur have really sort of, as I hear them talk about the solutions they put in place, seems like those multiple stakeholders are involved in those systems. And I know our Binti case management system is the same way. And you know, some solutions we see are constrained by purchasing licenses, and so an agency might not know how many people are going to use the system over time, and then have to ration sort of the access and licenses. I think it's really important to have a system that's usable by all the stakeholders and facilitates and encourages their collaboration. And the other, and it might be sort of a more of a refined point for the caseworker, but really surfacing the work that is time sensitive and making that easily accessible in the worker portal. So when I come to work in the morning, I see, based on my responsibilities, what are the most urgent actions. They're flagged for me, they're presented, there's some sort of icon or other sort of systems or reference. So I know things that might be overdue or soon due, or emergent in nature. And so the systems are able to surface that data easily and really guide sort of the next most important action for workers. So those are other aspects of a system I think are really important to keep in mind.
Great, thank you. I was wondering maybe we can go back to the main theme of this webinar too, because we are getting close to the end. I wanted to, going back to the main theme of person-centered design, I wanted to ask you, how do you feel that agencies can embrace person-centered design and technology for children's services? Can you maybe share any lessons that you've learned from your own experience in your own countries? Maybe I can start with you, Dario.
Yeah. It's a bit similar to what I said earlier with this design with and for the user. Super important to understand the target audience and these things, but that you build prototypes, iterate. So similar to what Rebecca said earlier, we once tried a big bang go live, and having an iterative approach. I think only an iterative approach allows you to have a human-centered design, because if you just design it yourself and then you show it to someone, it's too late to get the opinion and the feedback of people in. This goes well in hand, and I think what's often forgotten is this safety and privacy aspect, that on the one side, people are generally afraid when their data is being put in an IT system. So it's not that they're really informed about what happens to the data and how they're being, how the data is being treated. And when you work with with families that are being supported, or with social workers, that it's not an IT person coming from an office somewhere from the capital working with them, but someone who's directly in touch with them regularly, and he's or she's the one leading the feedback process to have a human-centered design. And other than that, I would just add on what has been earlier mentioned in the presentations from Binti on how important it is to have one central database, not to repeat the same question all over again, etc. One learning that we had was mentioned, but it helped us tremendously looking at an assessment holistically for the whole family, and not going family member by family member, but combining this into one screen, having all the 8 family members asking the same question at the same time. And we often saw systems being designed, you go through one questionnaire by person, the next questionnaire, the second person. But we realized that this is not very efficient, because mostly a mother would answer the questions anyway for the whole family at once. So ideally, you need to have all family members on one screen and then enter the data respectively per question. But with this, I would hand over to whoever wants to go next. Yeah.
Thank you. Ger would like to go to me.
Yeah, I think without repeating too much of what we've talked about already, but I think people mentioned that business process. I think that's really, really important, so that you don't depend on your ICT system to introduce a new way of working. So you have your business process worked out and you have everyone on board with that. That's really, really important to get that right. And I think Dario mentioned there the data protection and the legal context. Again, I think it's really important to work out that data sharing piece. And you gave some good examples of that, Alfonso, about consent of parents, let's say in the Dutch system, that when flagging is done, that there's consent got. We have a system in Ireland here where we have children who'd be at risk. We have a process for putting them on that risk, on that list. And that's very strictly adhered to. So different countries will have different standards of expectation. So it's really important to understand what your standard of expectation is in your legal context. And I suppose to do your data protection impact assessment on that. I think the other lesson I suppose we've learned is that, you know, depending on your ICT capacity, you may decide to develop something internally, or you may be able to get free software from somewhere else to develop something, or you may go to an external partner. And we struggled with that for about a year in terms of how we would develop that. We went out on a process to a number of different commercial partners to tell us what could they provide for us. And that was a really worthwhile experience to do, to see what's available in the market for the particular problem that we had. What were the solutions that were available? And I suppose the other thing I just echo what Duke had said there earlier about that sort of the use of predictive technology, you know, so the use of algorithms in social work assessment. I think, again, I'd be very wary of that, because I think the decision making we're making in child protection is very area specific, very ethnically driven. It's very hard to have those predictive tools maybe make those key decisions. And so we've steered away from that in our ICT development, where it's still very much that personal and professional decision based on the information that we get from the variety of different sources. So I think that may be some of the key lessons we have.
Yeah, and I'll just add on the human-centered design question. One of the things that we did in Virginia as an agency is we created a panel of individuals with lived experience. So we had a whole panel of children who had lived experience in the system. Then we had a whole different panel of parents, both foster care parents, as well as parents from families of origin that eventually had been reunified. And having these sort of bodies in place gave us a structure to do human-centered design, not just with our systems, but also with our policy. And you know, to the point of looking at both your policies and your business processes is just as important as your technology solutions. And so I think it's hard work doing true human-centered design. So creating a structure that facilitates that, I think, is we found that very helpful, rather than saying, okay, now I have a question about a new policy that I want to do, and then 3 months later, now I've got a new web portal that I'm creating. Having that same body of individuals, and we compensated them for their time, and they got to know us and we got to know them, and that was a really helpful, in addition to the traditional human-centered design work of observing and shadowing and doing structured interviews with workers and families. Thanks.
Thank you. Rebecca, would you like to comment to complete anything of what's already been said in relation to human-centered design learnings?
Yeah, I think everything, or not everything, but you know, a lot of the really important points have been touched on. So I don't have much more to add other than, you know, thanking the panel and just thanking you, Alfonso, and the ESN team for having us, and for all the participants who have asked a lot of really, really great questions and been very engaged throughout this webinar. So we really appreciate that. And we definitely don't want the conversation to end here. You know, again, there's been some great questions. And for those of you that didn't get a chance to ask, we'd love the opportunity to engage further with you, and you know, happy to share more about Binti and learn more about what you're doing in your agencies and in your organizations. So yeah, just really, really appreciate the time and the participation and the attendance, and for having us, Alfonso. So I don't have much more to add than that, but yeah, I really appreciate it.
Well, that's great. Thank you very much. I'd like to thank you, Rebecca. I'd like to thank Dario and Duke for being with us this afternoon. We've been almost 40 participants. Thanks a lot for all your questions. You've been very engaged, as you said, and certainly the conversation will continue.